UWorld percentage obsession is why you're panicking weeks or months before your exam. I just worked with two students who had virtually identical UWorld averages. Their blocks ranged from the 40s to the 60s. One of them just joined. She has stayed stuck in the 40s on her NBMEs despite months of studying. The other, she hit 71% on 2 consecutive NBMEs after failing Step 1 twice before. They had the same UWorld performance, but totally different outcomes. The difference wasn't how hard they studied or which resources they used. Instead, it was 8 invisible mistakes, things they were doing wrong and didn't even know it. In this video, I'm going to show you exactly what these signs are so you can fix them before it's too late. Let me tell you about this student. Now, the one who ended up with 71% twice was an IMG who grew up in the United States, but went to medical school in India. Like many students who grew up here, she wanted to come back to the States because this is where her family was, this is where her home is, but she was completely unprepared for the USMLEs. She graduated a few years ago and had been studying on her own for over a year, just grinding away, doing questions, reviewing content, and her highest NBME was about 40. Maybe low 40s at best. Now, she'd been studying for so long that she basically said, you know what, I'm just gonna take my test, even though her scores showed that she clearly wasn't ready. Surprise, surprise, she failed Step 1. She studied some more, and then she ended up failing it again. Then she thought, well, I don't know, I went to med school, I graduated, maybe I'm just gonna try Step 2 instead. And then she failed that as well, without having the NBME scores to even support it, just like she had with Step 1. By the time that she came to us, she'd failed 3 times total. She was exhausted, she was demoralized, and completely lost. She was clearly doing something wrong because there was a lot of effort, but there was not a lot of actual results. But she couldn't figure out exactly what the signs were, and therefore she didn't know what to fix. We had to completely rework her approach. We weren't focused on what she was studying, but instead, how she was approaching everything that she was learning. Now, here's the wild thing. Her UWorld percentages actually haven't changed all that much. They've actually stayed in relatively the same range as they were before, but her NBMEs have shown a significant improvement. But her NBMEs jumped to 71% on 2 consecutive exams. Now you can see here, her first NBME was a 43%. Under 3 months, she improved that by 28%. Granted, this is the same person who failed twice on Step 1 and failed once on Step 2. She's using the exact same resources she used before, the exact same content, but she had a completely different approach. And as a consequence, she had completely different results. Now, this wasn't about working harder. She'd already been working incredibly hard for over a year. It was about working differently. So what were these invisible mistakes? The ones that can keep you stuck for months or even years? Let me walk you through all 8 of them. Sign number 1 is that you focus on what instead of how. The first and biggest sign that you're studying wrong is that you focus on what you're studying instead of how you're studying it. Now, tell me if this sounds familiar. You go on Reddit, or you talk to one of your friends, or you talk to a mentor at your school, and you ask someone who scored high, how did you score so high on Step 2 or your shelf exams? Maybe you watched a YouTube video that says how I scored 270 plus or how I scored 280 plus. In all of these cases, note what it is that people tell you. In almost every single case, they're going to tell you what they studied as opposed to how they studied. What they studied would be things like UWorld, like I did 100 UWorld questions a day, or Anki, I did a bunch of pre-made Anki cards, or Sketchy, or Pathoma, or Boards and Beyond. They list these resources almost as if it's a recipe, which makes you think, oh, well, if I just follow this recipe, then I must be able to do the exact same that they did. So why is this a problem? I don't think that people are intentionally trying to mislead you, right? Genuinely, people are trying to help you. However, what I found is that people, particularly those who do well, oftentimes don't realize exactly what it is that they're doing, and in particular, the key things that are driving their success. Instead, people focus on superficial differences because that's what's easy to see and also seemingly easy to explain. Someone told me once that the things that we're best at are oftentimes the things that are hardest for us to be able to see in ourselves because they're so much a part of who it is that we are that it seems almost unnatural that someone could see the world in a different way. In other words, it's much harder to articulate the method behind how it is that someone uses those resources as opposed to what resources they're actually using. And so people default to giving advice based on what it is that they use. Tell me if this sounds familiar. You copy the list of resources that your friend used. You buy the same subscriptions and you download the exact same Anki decks and are watching the exact same videos, and yet you end up with different results. I know for a fact that there are tons of people who score really, really well using those exact resources. I also know that there are tons of people who fail using those exact same resources. In other words, if I were to go up to people who scored in the top 1% and I went to the people who scored in the bottom 1%, I can virtually guarantee that I wouldn't be able to tell who used which resources. This wasn't that different for our student who scored 71% on 2 separate NBMEs. She had done all of the right resources previously. She was using UWorld. She had tried Anki, although she had said, I'm not an Anki person, which is frankly one of the most common things that we hear from people. And she was doing all of it, right? She tried all of the right resources and a lot of other resources that now maybe other people hadn't used as much. She was doing the exact same things as people who scored in the 250s, 260s, but she kept failing. The issue is that the resources weren't the problem. How she was using them was the problem. The solution is to not ask, what resources should I use? Instead, you should ask, how should I engage with these resources to actually learn from them, right? In other words, are you just doing UWorld questions in order to hit your 100 question magic number per day? Or are you trying to actually use UWorld as a means to identify where exactly is the gap in my question reading process? Are you using Anki just because you wanted to do, 500 cards a day, which is what your friend did? Or are you using Anki to solve a specific problem, like trying to improve your recognition or trying to improve your retention, which is obviously a really critical part for your exams? The resources matter way less than your actual method. Instead, you want to focus on how. But here's what makes this even worse. Even when you change your approach, you might not know if it's actually working. Which brings me to sign number 2. Sign number 2 is that you're hoping your scores will go up instead of actually verifying that your method is working long before you take your next NBME exam. I know many people, including myself, who have been guilty of this phenomenon. Tell me if you've ever studied for weeks or even months and just thought, okay, well, I know I've got to do something different, and then hope that your next NBME is going to be higher than the last one. Maybe you keep doing questions. Maybe you saw a post on Reddit and you were like, well, I don't know, I'm going to try this thing and then hope that maybe the next time my score goes up, but we never actually verified that our method is actually working. And if you want to make sure that you can accelerate your score improvement and get the highest score in the shortest period of time, be sure to check the description below. There, we've laid out our 14-day free mini course where we, for 14 days, are going to send you some of our best videos on content as well as strategy. And so you can figure out exactly which of these signs are holding you back the most. And you can see how students who ended up scoring 250s, 260s or above actually mastered the content. So be sure to check the description and sign up below. At Stanford, they would often quote, when I was a medical student, trust but verify. And this is critical when you are studying, just as it is in residency. What is it that you should do instead to know if your score is going to go up by your next NBME, as opposed to just using hope as a strategy? We call this the 80% mastery method. So the principle is that when you study a topic, you want to be able to hit at least 80% on the questions that are related to that topic within 1 or 2 days. The goal is that within 24 hours that you go from not knowing that topic, like maybe you're scoring 20% or 40%, to getting 80% or higher in that same day. So if you can't do that, in our experience, coaching over 1,000 students, there's usually something fundamentally wrong with your study method. So why does this matter? One of the most common questions that I get from students is, am I going to be ready for my test by X date? My test is scheduled in 6 weeks, am I gonna be ready? Or I need to get a 260 because I wanna get into dermatology or orthopedic surgery or neurosurgery, and am I gonna be able to get this score by X date? The best way of virtually guaranteeing that you're going to get the score that you need is make sure that you can get to that target score in the shortest amount of time possible. So if the best that you can do when you study a topic is 50%, I can tell you right now, even if you continue studying that way for a year or 2 or 3 years, you're probably never going to get to your desired score of 70% if that's what you want to get. A lot of us hope that maybe magically, if we just get 50% for long enough, that just by doing all of those 100 question of UWorld days, that magically our score is going to go up. But frankly, that's usually not the case. Our scores instead are going to go up because we're going to get high scores on the individual topics that we're actually studying. Remember that what you can achieve on one subtopic is basically the maximum that you should expect to achieve overall. And so if I want to get a 260 on step 2, let's say, you need to get a little more than 80% on all of the questions on an NBME, which implies that pretty much everything that you study should be at that 80% or higher mark. If instead your method caps you out at 50% on all of your cardiology questions after studying cardiology, then that's probably about where your ceiling is going to be. Now, why is this such a valuable early warning system? Well, it's because this tells you very, very early on in your studying if your method is broken. One of the most painful things that I see happen to students is that they're gonna study for weeks or even months, and they're not gonna know until months afterwards that their studying didn't work until their next NBME shows it. In the case of our IMG from India, she had studied for over a year, and it was only after she'd failed 3 separate times on 3 different USMLE exams that she ended up realizing, oh, okay, there's something wrong. Instead, if she had used the 80% method, she would have figured out in probably 24 hours that what she was doing wasn't working, and she would have been able to pivot much sooner. Remember, hope is not a strategy. Verify your method works before investing weeks or months or years into it. And when you realize your scores aren't improving, here's what most people do wrong, and it makes everything worse. Sign number 3 is that you're making changes to your study plan based on fear, not based on actually solving real problems. One of the most common mistakes I see students make is they come up with the Frankenstein plan. Tell me if this sounds familiar. You're working really hard, your scores aren't really improving, and so now you're starting to doubt, maybe there's something wrong with me. When we start to doubt ourselves, then we start to look outside of ourselves, and then we think, well, maybe there's some sort of magic formula that our friends are following or magic resource that they're using, and that is the reason that they're scoring so much better than I am, despite the fact that they're not studying nearly as much. So in our panic, we go and ask all of our friends, hey, what are you using? Hey, what's working for you? Now, granted, you don't have to have bad scores for this to happen to you. I'll say that when I was at Stanford, this was one of the most common things I saw among students who were doing well. They would say something like, hey, I'm doing reasonably well, but I just want to know what it is that you're doing because I just want to make sure that I'm not missing something. Regardless of what drives you to it, it usually goes something like this. Your first friend says something like, I don't know, I'm using Sketchy. Maybe your second friend says, well, I just switched to Boards and Beyond recently. And your third friend says, wow, I just started using the Amboss questions and their knowledge bank is amazing. Your fourth friend then joins the conversation and says, I just used First Aid and oh my gosh, this has been such a game changer for me. Now, each of these things in and of itself might be true. However, then what ends up happening is that people try to do all of it and end up with the Frankenstein plan. The Frankenstein plan is an amalgamation of everything that everyone else is doing, which individually, maybe some of these things would have made sense. However, when you put all of these things together, it ends up being way too overwhelming and people end up not getting much, if anything, done. So why does this happen and why is it understandable? Well, when you're really working hard and you're not seeing results, it's normal to start to panic. And like we said before, the people that actually are the most anxious on exams are oftentimes the people that are scoring best on the practice exams. It's kind of ironic, but the people that have low NBMEs oftentimes aren't feeling nearly as much panic as people that are scoring 250s, 260s, or especially those that are scoring 270s on their NBMEs. Regardless, there's a big gap between your effort and what it is that you hope your outcome is going to be. And so as a consequence, people wonder, maybe it's me, maybe it's my resources. Fear takes over, and then based on that fear, we start copying everything that everyone else is doing, hoping that one of those things is going to be the magic thing that sticks. The problem is that behind this, there's no coherent strategy, there's no clear reason why it is that we're using each of these things, and it just is a collection of kind of panic-driven additions. The alternative is that you use principle-based changes to your studying. So, for example, you start with a problem. In my case, at Stanford, I was forgetting information that I studied after only about a week or 2. So I identified, oh, okay, well, this is my problem, I'm forgetting stuff. Therefore, I need to figure out what is the best solution for my particular problem. Right? In other words, I'm going to use a principle. I came to the conclusion that I needed to use spaced repetition and figured, okay, well, I need to figure out exactly how I can make spaced repetition work for my particular situation. Notice that I didn't say, well, I don't know, my friend uses Anki, and so I don't know, I want to do this because I'm too afraid that I'm going to fall behind him or something like that. The fear-driven approach is exactly what happened to our student. She kept going on Reddit and YouTube and things like that, and based on her fear, she would see what someone else was doing and think, well, I don't know, they passed their test, and so that must be the magic bullet for what it is that I need in order to go beyond my exam as well. Instead of having a principle guide her, she just wondered, I don't know, maybe this is the thing that's going to work. So remember, make changes based on principles, not panic. Every resource or change to your studying should solve a specific problem that you've identified, not just be something that you're copying just because you're afraid of falling behind your friends. But even when you have the right resources and the right principles guiding you, there's still another trap that keeps people stuck. Sign 4 is that you're treating your mistakes the same way, and that's why a lot of people get stuck. One thing that we've noticed after having worked with thousands of students is that people will typically hit different plateaus at different levels. So to pass an exam, or even just to get to average, usually you can get to to, say, an average score or passing an exam just based off of knowing enough knowledge. So people that cram a bunch of Anki cards or people that are really good at memorizing facts can oftentimes hit up to 50th percentile or maybe even a little bit higher if they're a good test taker. Now, note that knowledge can get you to that baseline, but what got you here won't necessarily get you there. In other words, if I want to get a higher score, if I want to get 250s, 260s, or 270s, then just having more knowledge is not going to be the fix. The reason for that is that when we've acquired so much knowledge, then the mistakes that we're making are usually not based off of the things that we don't know. Instead, the mistakes that we have left, in other words, the questions that we're still getting wrong after we've built all of that knowledge base, are usually not going to be knowledge based. Right? Makes sense. Instead, there are things like pattern recognition failures or reasoning errors or test-taking mistakes, clinical thinking gaps. But the problem is that because we've gotten so used to improving our score by memorizing more or learning more things, we get stuck in this one-size-fits-all trap. We see this all the time. A student gets a question wrong and they think, well, I need to review more of that topic. And then they get another question wrong and they think, okay, well, I need to do more Anki cards. And then they get a third question wrong and they're like, well, I guess I got to go to first aid again. It makes sense because up until this point, that is actually how they improve their score by so much. Now, let me give you a counterexample. We had a student from the Caribbean who literally went from 230 to 263 on her NBMEs in about 2 weeks when she was studying for Step 2. Again, it's virtually unthinkable to improve your score by 33 points in just 2 weeks based off of only learning new things. She didn't do this because she somehow learned a bunch of new content. Instead, she did it because she got really good at identifying what type of mistake that she was making. So she would analyze each mistake and say something like, okay, well, my first problem is that I'm not doing a good job of rearranging things chronologically. I'm just taking it in the order that they're giving it to me. I'm not actually trying to rearrange it and say, okay, well, this actually happened first in the story and this happened second and this happened third. She would identify, okay, well, it's not really a knowledge problem. This is really more a problem of chronology, is what we call it in our system. The key principle behind this, and the one that you want to remember if you want to get the highest score in less time, is that different mistake types require different solutions. In other words, if you have a knowledge gap, then yeah, you're probably going to need to review content or work on a system for retention. If you got a pattern recognition problem, you're going to want to do similar questions. You're going to want to work on things like your illness scripts, or what we call in our program, pathophysiologic chronologies. If you've got a reasoning error, then you probably want to slow down. You probably want to work on things like ruling in answer choices first before you rule them out. The key point is that there are many different kinds of problems that will prevent you from getting a high score. Each of those problems requires a different approach. Note that this is very different from the common advice that everyone gives, which is like, oh, just do 100 UWorld questions a day and you're going to be fine. Remember, doing 100 UWorld questions a day is the right solution for a specific problem. Just because someone got a 262 on Step 2 and they were doing 100 UWorld questions a day doesn't mean that doing 100 UWorld questions a day is the right solution for every single problem. Instead, try to identify every single possible step that you would need to have, be it knowledge, pattern recognition, understanding vitals, understanding labs, whatever it might be, and try and figure out which of those steps are the problems that you have, and then figure out what the biggest problem is, and then fix that problem. And then rinse and repeat. Once you fix that problem, then figure out the next problem, and then figure out how to solve that problem. Remember, not all mistakes are the same. You want to diagnose the problem type before you prescribe the solution. Just because something worked well for one person doesn't mean it's going to work for every single problem for every single person. And here's where a lot of students compound this problem. They're so focused on getting through material that they miss this next sign entirely. Sign number 5 is you obsess about how much instead of how well. How many times do people get obsessed with how many questions that they're doing every day instead of how well they're learning from them? I would say it happens all the time. So let's talk about the quantity obsession. How many times have you heard someone say, I need to do 80 questions a day? Or my school told me I have to get 120 questions a day in TrueLearn done, because that's what we found that the students that do best are doing every single day when they're studying. Then they feel like, oh my gosh, I'm constantly behind in UWorld, I need to catch up. Oh, my friend did 120 UWorld questions a day and they scored a 265, so I should probably do that too, right? Kind of echoing the Frankenstein plan. The issue is that they're tracking numbers, not actual understanding. And so racing through blocks just to hit a quota oftentimes is the wrong solution for a lot of people. The key issue is that you have to understand this stuff. You can't just memorize it. You have to be able to actually apply these things, and that's exactly what the NBME is testing you on. These aren't the days of simple recall, which maybe happened to you in your first couple years of medical school. I remember distinctly that there was one guy at Stanford who was a year ahead of me who would say that, you know what, like, you don't actually have to understand this stuff. All I do is I just do a bunch of the previous year's practice tests before I go into my test. and I can still score pretty well on the exam because they repeat a lot of the questions. That might be okay for your first couple years of medical school, but it doesn't work on the USMLEs. These are people who are very good at changing the details on the exams. They're trying to get you to actually apply real principles. What would it look like to actually improve the quality of your learning? First of all, after a question, try to figure out, can you explain why the answer is the right answer? And also try to figure out, can you explain why each wrong answer is wrong? One of my favorite tricks is to use the Feynman technique, which is where I take something that I've learned and see if I can teach it to someone who ideally is kind of at the level of an intelligent fourth grader in whatever it is that I'm teaching them. Whatever it is, just make sure that if you were to see a similar presentation with different details, would you still be able to recognize the pattern? And if you were forced to use this principle in a different organ system or in a different disease, could you still do it? The challenge is that it's very difficult to measure understanding. In contrast, it's actually really easy to measure the number of questions that you're doing, the number of pages that you've gone through, and the number of videos that you've watched. It's really easy to feel productive because you're able to check more boxes off in the day. But if you can't remember what it is that you learned yesterday, you're really just collecting exposure, not actually building mastery. This is why this is one of the most insidious signs that people have when they're studying and they have problems but don't exactly know why. It's because it's really easy to have the illusion of progress. So in the case of our student who went from failing 3 times to scoring 71% on her last 2 NBMEs, really what we did is we just reduced dramatically the number of questions that she was doing every day and instead made sure that she actually understood what it meant to learn something well. I distinctly remember one of our first conversations, which was, I told her something like, look, I'm going to tell you something that's really uncomfortable, and I'm doing this because I'd rather that you hear it from me now than you hear it from your next exam because you failed it. I don't think that you're understanding these things as well as you probably should be. And as a consequence, I don't think that you're getting questions correct for the right reasons. So what we need to do is we need to make sure that everything that you learn, you can get to at least 80% on that thing before it is that you move on to the next topic. Now, to her credit, she was very receptive to this, in part, I think, because she'd failed 3 times. And so she really did slow down, and she really made sure that instead of focusing on how much she was doing every day, she was focusing on how well she was learning it. Remember, your goal isn't to finish UWorld. Your goal is to understand every pattern and every disease in UWorld. Quality beats quantity every single time, especially when you have the ability to never forget what it is that you learn using something like spaced repetition. But even when you slow down and focus on quality, if you're approaching the questions themselves the wrong way, you're still going to struggle. Which brings me to sign number 6. You don't have a systematic way to read questions. This is one of the most common mistakes that I see people make, is that they don't have a systematic way of reading questions, or if they have a systematic way, it is something like they read the question first, they then read the answer choices first, and then they go back to the beginning of the vignette and then try and kind of scan for buzzwords. Now, why do I think it's wrong to read the question and the answer choices first in the vast majority of cases? First, let me start by acknowledging that it feels very efficient because it's nice to kind of know like, oh, okay, well, they're asking me about what the signs or symptoms are of this disease, or they're asking what's the pathophysiology of this condition. It feels strategic because most of the exams up until this point, this is actually not bad advice. Like for example, for the SATs or even the MCAT on the reading section, it's actually good advice to read the question first because you want to know what it is that you're reading for so that you can hone in on the most important details. Now, despite the fact that this works for some tests, the math actually shows that this doesn't work for all tests, especially for things like Step 2 and shelf exam. The reason for this is that up to 50% of Step 2 and shelf exam questions are diagnosis questions, and up to 40% of questions on shelf exams in Step 2 are management questions. Now, note that if it's a management question, you also have to know the diagnosis in the vast majority of cases. So what that means practically is that for up to 90% of your exam, you're going to have to understand the full clinical picture. Either because you're going to have to know the diagnosis, or you're going to have to know the diagnosis and the clinical scenario in order to figure out the management. So why does reading the answers first backfire? First of all, spending that extra 5 or 10 seconds reading the question and the answer choices can bias your thinking, so that if you read one of the answer choices that's wrong, it's really easy to now start to see evidence of like, oh, well, I don't know, maybe it is that thing because they, clearly that answer was the heart attack answer. And so I don't know, maybe this was the sign that there was a heart attack. Another reason is that when you have less time to read the question, you're oftentimes going to miss critical errors. How many times have you gotten a question wrong where you realize after you reread the question, oh my gosh, I totally didn't even understand that that's what they said, or I didn't even realize that that word or that phrase or that sign was there to show me that this was the right answer. Plus, let's be honest, like we said before, it's not even that helpful to know that it's going to be a management question, or it's not that helpful to know if it's going to be a diagnosis question, since in most cases, it's going to be one of those two things. And in most cases, you're going to have to read the question in a very similar way to know what the right diagnosis is, or even to know what the right management is going to be. Instead, when you're reading a question, we like to use the context, chronology, severity framework. Context means, do I understand what the sentence means in context? Remember, most signs or symptoms in a vignette are not themselves pathognomonic. For example, in a heart attack, chest pain is not diagnostic of a heart attack. In addition to that, ST elevations even is not necessarily diagnostic for a heart attack, and even troponins is not diagnostic for a heart attack. However, when you put all three of those things together, chest pain, ST elevations in a particular distribution of the coronary arteries, and troponin elevations, that is a heart attack, right? And so you need to first understand the context of each of the sentences that you're reading and put it in and connect each of these sentences with each other so that you can see the full picture. Second, chronology. Naturally, vignettes are going to be out of order from the actual chronology that they happened in. So for example, you might get a vignette that says something like, a 25-year-old woman is brought to the emergency department because she was, she passed out after a long flight. And then they would say something like, well, she started OCPs 3 months ago and she's been a smoker for the last 5 years. The actual chronology wasn't that she was brought in first, and then second, she started OCPs, and then third, she was a smoker, right? In reality, she was a smoker first, and then she started OCPs, then she got on a long flight. If I put that in chronological order, it's a lot more obvious that what's going on is probably something like a DVT-PE, and if that's the case, then her syncope is probably due to hypotension because maybe she's got right heart failure, and so now she can't get enough blood going to her left ventricle and to then supply the rest of her body. The final thing that you're looking for when you're reading a vignette is severity. Signs of severity would be things like, how are they presenting? So for example, the woman that was brought to the emergency department, that's like the worst kind of presentation that you can get, because if you cannot bring yourself to the emergency department, especially if you are young and probably otherwise healthy, that's a pretty significant sign of how severe the condition is. In addition, things like having shock vitals, where especially if your heart rate is above your systolic blood pressure, it's a pretty good sign that there's probably a problem in your cardiovascular system, and signs of end organ dysfunction, right? So for example, if you've got low urine output, it means that your kidneys probably aren't perfusing very well, and so you're having kidney dysfunction. Or if, for example, you have poor capillary refill, that's a sign that you've got circulatory compromise. So when you're reading a vignette, always think context, chronology, and severity, rather than reading the last sentence first and or reading the answer choices. Remember, the USMLEs are testing clinical reasoning, not keyword recognition. So they want you to be able to think through the case as opposed to just scanning for buzzwords. Now, even with this systematic approach, there's a specific situation where almost everyone still gets stuck, and it's probably costing you more points than any other mistake on this list. This brings us to sign number 7, you're being a lawyer instead of a judge. Now, when you're stuck between two answer choices, oftentimes people are a lawyer instead of a judge. And that's why you keep choosing the wrong answer, even on topics that you've studied well and that you know really well. And that's why you keep choosing the wrong answer, even on topics that you actually know. Now, let's talk about what a lawyer means versus what being a judge is. A lawyer mindset is where you're looking for what's wrong with each answer and trying to eliminate based off of perceived flaws. A judge mindset is going to balance what's right and what's wrong about an answer and weighing which answer has the strongest overall support, even though it might not be the perfect answer. Because here's the thing. Oftentimes, people are not actually stuck between two answer choices. Although we hear this all the time where people say, I get stuck between two answer choices and I end up choosing the wrong one more often than not. It's actually not that they're stuck between two answers. It's usually that there's one that they're considering more than the other. And the issue is that maybe it's 80% correct, but 20% of it just doesn't quite feel right. And so because they're not 100% certain, that doubt starts to creep in. And then the lawyer mindset starts and they start to look for what's wrong with it. And so because that 20% doesn't quite fit perfectly, they say, well, this isn't quite right, so I don't know, I've got to eliminate this. And then they choose the remaining answer, which is actually worse overall, because they didn't really consider why it would make sense. They just said, well, I don't know, if it's not A, then it must be B. So for example, there was a student that wanted to match into pediatrics, and she got a Klinefelter question wrong because despite the fact that it was pretty classic Klinefelter, and she had thought Klinefelter, I don't know, half of the way through the question, the patient wasn't tall. And so she knew in her head, well, classically, Klinefelter patients are tall. And so, I don't know, this doesn't quite feel right. And so she eliminated Klinefelter and then chose another one of the answer choices. Remember, medicine isn't black and white. Instead, the best answer often has a few exceptions or atypical features. You're not looking for a perfect answer. Instead, you're looking for the most correct answer given the clinical picture. So remember, be a judge, not a lawyer. Pick the answer with the strongest overall support, even if it's not perfect. And finally, here's a mistake that sneaks up on almost everyone, one that creates panic at the worst possible moment. Sign number 8 is you think that time management means reading questions faster. This is really common, and it was a mistake that I made myself, which is that I thought that I was running out of time on questions because I was a slow reader, which technically was true, but what I realized is that that wasn't really the real problem. Now, have you ever been in the middle of a block and then suddenly you look at the clock and realize that you've got, I don't know, maybe 10 or 20 questions left, but you've only got 5 or 10 minutes left to do it in? Then panic starts and you're like, oh my gosh, I need to read faster. Now, what most people think, including myself, is that, oh, well, it's because I'm a slow reader. That's why I'm having a hard time with time management on my blocks. The problem is that if I think that I'm a slow reader, the solution seems like I need to either take a speed reading course or just figure out how to speed up my reading of the vignettes itself. What I can tell you after working with thousands of students is that the most common reason why people struggle with timing isn't that they are slow readers. It's actually that they're perseverating on maybe 3 to 5 specific questions, usually in the first half of the block, and spending 3 or 4 or 5 or more minutes on each of those questions. In other words, it's not a problem of their reading speed, it's a problem of, I can't let this question go. So I'll give you an example for me. So when I was at Stanford, I did an HHMI grant for studying lung cancer. And specifically, I was studying small cell lung cancer. And so I did an entire year of research on this, plus basically another couple summers. I knew lung cancer like the back of my hand. And so whenever I saw a lung cancer question on one of the USMLEs, I was like, okay, I cannot afford to get this one wrong because it was kind of tied up in my own sense of identity because I'd spent so much time on this thing. What this meant is that I would sometimes agonize on those questions and I would read it again and again. And I would keep trying to figure out I don't know, there must be something that I'm missing. 5 minutes had gone and I still hadn't chosen my answer because it was almost as if my identity and sense of even self-worth was wrapped up in the outcome of this question. The reason I know that this is the problem as opposed to slow reading is that if you actually sort questions on UWorld or one of the other QBanks based off of the amount of time that people are spending on them, you'll oftentimes find for people that are struggling with timing, they're spending more than 2 minutes on a question on probably 3 to 5 of the questions in the first half of the block, and therefore they're running out of time on the other question. It's not that every single question that they have is taking them 2 minutes or longer, which again would mean that they truly were reading too slowly. The reality is that it's a small number of questions that are taking a disproportionate amount of time. The reason why this matters is that every single question is worth the same number of points. And so if you spend 5 minutes on one question that's really hard, that you're honestly probably not going to get right anyways, it's going to mean a lot less time for the questions at the end of every block. And so what you're ultimately doing is you're trading easy points for hard points. The solution to this is that you want to set a timer for 2 minutes maximum for every single question. I actually recommend when you're doing timed blocks on a QBank to actually set your phone timer for 2 minutes and reset it every single time you go to a new question. The reason for this is that you want to know intrinsically what it feels like to be at the 2 minute mark. What most people find is that 2 minutes is actually a lot of time. The counterintuitive truth is that students who move faster through hard questions oftentimes get more points, since at the 2 minute mark when they're guessing, they probably aren't going to get that question correct even if they spent an extra 3 minutes on that question. However, by not wasting that extra minute or 2 or 3, they're able to get more of the easier questions correct at the end of their block. Remember, time management isn't about reading faster, it's about making decisions and moving on. You have to let go of the perfectionism. So those are the 8 signs that you're studying wrong for the USMLEs and don't even know it. First, you're focusing on what instead of how. Second, you're hoping instead of verifying. Third, you're making fear-based changes instead of principle-based changes. Fourth, you have a one-size-fits-all approach to mistakes. Fifth, you're obsessed with how much instead of how well you're learning things. Six is that you don't have a systematic way to read questions. 7 is that you're a lawyer instead of being a judge. And 8 is that you think time management means reading questions faster. Remember that student I told you about in the beginning? The IMG who failed step 1 twice and then failed step 2, the one who had the same UWorld percentages as another student, but improved her score by more than 28% in 3 months, she had all 8 of these signs, literally every single one of them. And once we systematically fixed them, once she could actually see what she was doing wrong, that was when everything changed. She was using the same resources, the same content base, but because she had a completely different approach, she had completely different results. So now look at your own study approach. Which of these 8 signs do you recognize in yourself the most? And be honest, most people have at least 3 or 4 of these. And to be really honest, you actually probably want more of these problems, because the more problems that you have, the more opportunities that you have also to improve your score in less time. The best news is that they're all fixable problems, but you have to fix them now before test day. And so don't wait until you failed to figure this out. Or if you have failed, make sure that you start implementing these fixes now. These mistakes are invisible until someone points them out, but once you see them, you cannot unsee them. And that's when everything changes. Next, I'm going to open this up for the most commonly asked questions about these particular issues. All right, so the first question is, how do I know which of these signs that I have? They all kind of sound like me. It's pretty common that a lot of people will have a lot of these particular signs. The simplest thing that you can do is, if you see a sign, you can work on it. The slightly more sophisticated way of doing this is, like, if you try to focus on 10 things at once, you're probably not going to get very far with any of them. Instead, you want to just be objective and honest with yourself and ask yourself, okay, which of these mistakes or which of these signs do I have more than others? For example, when I coach a student about question interpretation, one of the things that I'll have them do is I'll have them write down, okay, so context, chronology, severity, standalone question, rule in and rule out, and then a variety of other mistakes that people make when they're reading questions wrong. I will then ask them to identify 4 questions they get wrong, like how many of those mistakes were they making and how frequent were they? I can tell you off the top of my head, one of the most common mistakes that people make when they're reading questions is lawyer versus judge. So if you find that you're making that mistake, that's a pretty good one to start with. In addition to that, actually tracking the mistakes that you're making and the frequency of those mistakes can be really helpful, because then you can figure out, okay, well, which of these things should I focus on first as opposed to later? In a general sense, this is a good approach, because you want to figure out, well, okay, which of these things am I doing more than others? The second question is, what if my UWorld percentage is already really low, like in the 30s or 40s? Is it too late? The answer is that it's never, ever, ever too late to improve your scores, especially if it's really, really low. If your problem is that your scores are really low, like in the 30s or 40s, typically there is a strong knowledge component. The kinds of things that you're going to want to focus on at first is, can I get to that 80% threshold within a day or 2? Because if you can't do that, it means that there's probably something wrong with the way that you're learning things. And that is, no matter what else you do, no matter how many questions you do, no matter how long you study, no matter how many hours a day you're going to be working, it's still not going to lead to a very high score, and you're probably going to stay stuck pretty close to where it is you currently are. And so, like in the case of that student, the IMG that we talked about earlier, her scores were like in the 40s on her NBMEs, and on her UWorld blocks, they were pretty similar to that. Sometimes they might get up to the 50s or 60s, but they were kind of in that range. Ultimately, once she learned how to get to that 80% threshold, she figured out, oh, okay, this is what it takes in order to learn something well. And once you know what it takes to learn something well, you can do it again. And so it's really getting to that first 80%. And then once you get to that first 80% on 10 consecutive questions, then can you do it again in a day or 2? And then once you do that, can you do it again in just a day? And ultimately, that's the cadence that you want to be able to do. The third question is, I do read the answer choices first. Why is that actually bad if it works for some people? Now, I think the challenging thing is that any strategy will work at least some of the time, at least if it's a semi-reasonable strategy. The challenge isn't, can I find a strategy that works some of the time? The challenge is, can I find a strategy that works more times than another strategy? In other words, not asking, can this give me 1 or 2 extra questions, but compared to other strategies, what is going to give me the best score? The good news is that this is something you can test empirically. You can actually test yourself and read the answer choices first and the question first, and then actually spend more time reading the first and second sentences and third sentences and trying to put those together. Where does that 5 or 10 seconds lead to a greater score? What you'll find if you do it properly is, at least in our experience, that spending more time on the first 1 or 2 or 3 sentences and really trying to put those signs and symptoms together and generate a better differential will typically yield a better result than reading the question and the answer choices first. Because it's true, if I read the question on some questions, maybe 1 or 2 questions per block, I might not even need to read the entire vignette at all. The issue isn't, can I get some questions correct if I were to read the question and the answer choices first? The question is, what would give me the best score? And typically, is it worth it to do for 40 questions, reading that last question and all the answer choices and wasting maybe 10 seconds for maybe 1 or 2 questions that it might really help me with? Or is it better to figure out what the first and second and third sentences mean relative to each other, which is probably going to help me on 90% of the questions? The next question is, how do I implement the 80% mastery method practically? What exactly should I do? So it's a good question. The short answer, and again, we've got a lot of other YouTube videos where I go into more depth on this, but the short answer is, you want to do a subtopic. So we personally recommend doing coronary artery disease first, because it's something where you don't have to know a lot of other things about medicine in order to understand that, well, if I block an artery and it can't get blood to the heart muscle that it supplies, then that heart muscle is going to get ischemic and eventually necrose, right? Pretty straightforward idea. You want to go to first aid. Ideally, personally, I like step 1 first aid, but you can use the step 2 first aid too for this. It doesn't really matter. And I want to learn all of the material that is relevant to coronary artery disease. So I'm going to learn about the ischemic heart disease section where it talks about stable angina and unstable angina and ACS and things like that. And then in addition to that, I'm going to want to learn that page where it talks about the different phases of an MI. And at 24 hours, you're going to see more neutrophils. And by day 3 to 5, you might start to see more macrophages, and et cetera, right? I'm going to want to learn that at depth. I'm going to want to learn and understand, why does this make sense? And as I'm doing this, make Anki flashcards so that not only can I learn it better, right? It's like a form of taking notes. And in addition to that, it also is going to give me the ability to remember it in the future, right? Because if I can get that 80%, I want to never, ever forget that, right? Just learning those 2 skills, like how can I get something to 80%? And how can I make really good Anki cards so that I never, ever, ever forget it? If you can combine those 2 things, you can almost guarantee yourself getting any particular score, especially since to get a 260 plus on step 2, I need to get about 80% on an NBME. So if I just did this for every single topic on the NBME and I just never forgot it, then it's very difficult to imagine how I couldn't get to a 260 level knowledge. It doesn't mean I'm going to guarantee getting a 260, because obviously I still have to work on the question interpretation aspect of it. But from a knowledge standpoint, you will definitely get to the level of having a ceiling of a 260 or even higher. As I'm going through first aid, I want to make sure that I can explain all of the different aspects of first aid. And then I'm going to, make my cards. And then I'm going to do another block of questions, and I'm going to see, okay, can I get at least 80% or more on 10 consecutive questions? So that's the short version of it, but I would definitely also hit like and subscribe, hit the notification bell so that you can be notified every single time we put out a new video, because we talk about this stuff a lot. Now, if you're wondering, okay, I can see these 8 signs, but what should I actually be doing with UWorld? I've got you covered. This is a complete guide breaking down the 5 levels of UWorld mastery, from starting at failing scores all the way to 260 plus. It's called the UWorld Complete Guide, the 5 levels of mastery to 260 plus, and it shows you the exact settings, block sizes, and progression system you need at every single stage. Whether you're scoring in the 30s right now, or you're already at 220 and want to push higher, this video will show you exactly what to do next. Click on it now. It's the perfect companion to what we just covered, and let's go.